Good afternoon, everybody. Can you hear me okay?
Yep, we can hear you.
Awesome, thank you. Okay, so I will just jump right in. I think we might have a slightly shorter meeting today unless everybody brought more questions. But I've got a few things I want to cover. For those of you that maybe weren't on last month, these meetings are really just designed to be sort of an open forum for questions, answers, to the extent we have answers, sharing, whatever's on your mind related to the opioid settlement fund. So feel free at any point to unmute yourself and jump in and either share an idea or a question. And, just when you're not talking, try to keep it on mute so that we can hear everybody. So how I wanted to start today was to follow up with something from last month's call. There were a lot of questions about reports. And so I reached out to the Department of Management, State Auditor's Office, and the Assistant Attorney General that we've been working with on this, Bill Pearson. And Bill got back to me with some answers to, or at least some information to all the questions that I had submitted that I hope covered what we had talked about last month. Bill's not able to participate today, so I'm just basically going to kind of read through the questions and responses. Like I said, feel free to jump in, and if there are more follow-up questions, perhaps we can try to schedule next month's meeting around his schedule so we can get him on here for a little more back and forth. But I do think we've got some good information. So the first one that I asked, does each settlement need to be held in a separate fund, or can all the different settlement dollars go into one opioid settlement fund? I know there's some questions in terms of like tracking, if you needed to be able to track what a particular settlement's dollars were going towards. And so he said that they can all be put in a single opioid settlement fund. And so then the follow-up to that is if they can go into that one fund, then how does the county determine when it's spent certain what they've spent certain settlement dollars on? And so Bill's response to that was, to the extent a county needs to determine what is it's spent on certain settlement dollars on, which at this point, I think this is the one we discussed last month, it's only necessary for the Mallinckrodt funds that you've received from the NOAC 2 settlement. And that is because it's a bankruptcy settlement. But he said you can simply calculate that as a pro rata share of the total funds spent. This is what other states and counties are doing based on his conversations with a multi-state group that he's involved in. So for example, if the county received $100,000 total and 10,000 of that was from the NOAC 2 Mallinckrodt settlement, and you've spent $20,000 of your 100,000 so far, when you do your NOAC 2 Mallinckrodt report, you can report 10% of 10% of the 20,000 or $2,000, since the NOAC funds were 10% of the total funds. So does that make sense to everybody? You don't actually have to know that that specific dollar went to whatever project you're working on. You just sort of prorate it based on what percentage that Mallinckrodt settlement is of your total, and then what you've spent total so far. Questions, concerns, follow up on that, because I know we had a lot of questions about that last time. And I will send out these question answers from Bill after this call as well to everybody.
Yeah, since we're creating separate accounts for the funds, I was hoping just to continue to submit to NOAC $0, $0. Is that still a fine strategy?
Yeah, Gabby, I think if you've already set it up that way, that's completely fine. And, probably even a little more clear that you actually know whether or not you've spent those specific dollars on a project or not, because you've set them up separately. But just for counties that maybe don't want to have to track, smaller amounts that way, they can do this sort of pro rata thing. Yeah, good question. Any other questions, comments about that? Otherwise, I'll move on to the next question. Okay. Then I just wanted to make sure with Bill, because, we don't always get notices about all these reports. And I know there have been some reporting questions. So what reports are currently required besides the annual state report? And so the additional reports are to NOAT 2, which is that one that we were talking about, which was due at the end of last month. So due at the end of March. And that's for the NOAT 2 Mallinckrodt spending. So basically a report of what the pro rata share is, or if you're doing it like Polk County, what you've actually spent on that settlement. And then a report to the administrator for the other settlement. So that's Brown Greer of non-opioid abatement expenditures. So that's the one that you've got. If the county has not spent any money for non-abatement purposes, then you don't have to do that report. So the only two reports that you're consistently doing right now is that annual report to the state and the NOAT report. And then if you've spent any settlement funds, any of the settlements, for non-opioid abatement expenditures, then you would do another report with Brown Greer. So those are kind of the three that are floating out there currently. And then kind of to go along with that, my next question was, of the other reports, what ones are only required once funds have been spent, and what ones are required once funds have been received? The NOAT 2/Mallinckrodt report is required regardless of any funds were spent. So if you haven't spent any funds, you can just report 0 on that report. And then the report to Brown Greer is only required in the event of spending for non-abatement purposes. And then of course you have the state annual report that you do either way. I think I already mentioned this, but I just verified that NOAT 2/the Mallinckrodt report is the only one that is related to a specific settlement at this point. And then the other question I had was, everyone has done their state reports, their annual reports. I asked if those would be posted somewhere so counties could take a look at what others were doing. I get a lot of questions about examples or have other counties done this. He said that they're still trying to figure out what they're going to do with those reports, but they are public records, so anyone can reach out and request those. So if there's an appetite for ISAC to make a request for those and share them in some way, they certainly can. Or, just if out of curiosity, any of you are working on something and want to see if someone else has done it by looking at those reports, you can access those as well. So those are the questions that I asked of that group. Oh, Jan asked if they could be put on Basecamp. Yep, we can do that too. We still have that Basecamp group set up as well. And I will make a note to make sure we get those Q&As put up there as well. Okay. With those questions, does that trigger any other sort of follow-up questions? Oh, somebody had a question about if a report can be amended if need be. I don't have a specific answer to that. I would assume so. I would say, if after hearing this, you're like, oh, I wanted to do something differently on those reports, I would reach out to whoever the correct agency is for that report. So I believe that there's an email for that Mallinckrodt report, and I can track that down for you if you need it. That's who I'd reach out to if it's related to that one. If it's related to the state one, I'd reach out to Bill Pearson at the AG's office. And then if it's the Brown Greer one, I reach out to Roma at Brown Greer. And I think we included her contact info after the last meeting, but if somebody needs that, I can definitely get it to you. There's questions about, could the dollars be put into an endowment fund to use that way? Chris, can you tell me a little bit more about what you're thinking with that?
I thought during the training that we had in Des Moines, was that last year or the previous year, there was a discussion that those funds can be put into an endowment fund. That way they can be continued to be used over years instead of possibly just for a short period of time. And I thought it was said during that training that you could do that.
Yeah, so there have been some questions, in terms of sort of investing those funds. I think you'd want to follow any sort of investment requirements that county dollars would have to be, ways that county dollars can be invested. I would say it'd be the same way you could invest these dollars. There's also, and I'm blanking on what the term is for it, but we'll say endowment. There is a way to like sort of get your funds ahead of time, basically by like selling shares in those payments that you're going to get. There was a lot of talk for a while about structuring things that way because it allowed counties to kind of get their money up front instead of waiting a long term of years. There's a cost associated with doing that. And I do think there was a lot of question about whether or not that was allowable, both under state law and under the national settlement terms. And I have to tell you, I'm not totally up to date on where that all kind of panned out. If any securitization, there's somebody who did it for me. Securitization, thank you. Yeah, we never heard any formal guidance on that, and I haven't heard much about it lately either, which sort of tells me that perhaps that at the national level was decided not the avenue to go. But I can reach out to Bill Pearson as well and see about that and see if he's heard any more about that. If that's something your county is interested in doing, I would definitely talk to your county attorney before proceeding that way. And I'd probably also talk to the AG's office and maybe even Aaron Dickinson just to kind of understand where that is from a national settlement perspective. Because like I said, there's a cost to that. And the cost of doing that is not related to opioid abatement. And so there's pretty strict rules on how much you can spend on administrative non-abatement type costs. Which kind of ties into somebody had a question about what do you mean by non-abatement? And so non-abatement, most of these funds are supposed to be used to abate the opioid epidemic. And so to the extent that you're using them for something else, administrative type costs, administrative costs are the main one I can think of, but perhaps there's other examples. That's what that's getting at.
Well, and Christy, what I was looking at was not securing the funds ahead of time. It was using the funds that we've already received, establishing an endowment with that fund through the county, not through other agencies or other people, but the county would establish the endowment and then they could utilize those funds over a longer term based on that endowment that they have. And that was my understanding of it at that meeting in Des Moines, was you could do that. The interest continues to go into that endowment fund and it all is for the abatement activities. It's not for non-abatement activities. It's for the abatement activities listed out in that attachment that we received.
Yeah, so I don't see any problem with that so long as, however, those endowment funds are invested, it's an investment that you could invest county funds into. It would follow all the same rules for county investments. But if anybody wants to jump in, if they've looked at something like that, that's not something I've spent a lot of time researching. But I would say in general, you want to follow the same rules as you would for any other county funds.
Great, thank you very much.
Yeah. We had another question kind of along those lines. Here, first I want to go to this. I don't think it would be allowed. Yeah, having others to invest those funds. So, but it sounds like, Chris, you were talking about having the county actually establish that endowment. So I think we got that covered. There was a question about, can the funds be put into a scholarship type fund to award recipients who complete an addiction program? That's going to come back to this question we've had time and time again. You'd want to take a look at the MOU and those uses, but I don't think there'd be anything in there particularly that would prohibit a scholarship type program. You just want to make sure, like so many of these questions, how do you ensure that it's being used for a prescribed use under the MOU? And then how is the county going to kind of track and oversee that that's being done? But I don't know, has anybody looked at sort of a scholarship type program that they could share about? Maybe not, but if anybody tries that, let us know. I would love to start sharing, documentation and things that folks have. The other two questions I got ahead of time were ones that really are just, I'm hoping, input from the group more than any sort of legal or technical questions. What processes have other counties used to determine subawardees and to monitor them for compliance with MOU eligible uses? And along those same lines, does anybody have a template or an example of an application form for opioid settlement funding?
I can jump in since this has been what I've been working on pretty heavily the last couple weeks. So my name is Gabby. I work in Polk County as our opioid settlement program planner. I created an application that was similar to our community betterments grants applications, which is our the money from the casinos that gets distributed out to community organizations for whatever their heart's desire. So I looked at that as my baseline, and then I added in information about the population that they intend to be serving. I looked at the reports for the AG's office and NOAT, and then made sure that all the information that I would need for the reports was included in the application. And I also asked them what their proposed impact would be, how they're involving people with lived experience, and sort of those best practices and guiding principles of how to be best stewards of the funds. So that will be made public hopefully tomorrow, and I can send it to Christy to send out to the group. And as far as the compliance and oversight piece, we are again following our community betterments grants, which is they have to maintain records and receipts, methods of payment, and submit that by because on the reporting deadline for us. So a few months before before we have to submit the AG report, which is the end of the calendar year, but after our county fiscal year. So I'm asking them to have all of that ready by September so that I can make sure that, yes, they were spending the money on opioid abatement strategies, because our lawyer is saying that's really all we're required to do, although your lawyer might say differently. And just look at that for compliance. So it's kind of a, wild west of the opioid settlement funds, but happy to share what we've put together.
Yeah, Gabby, I think that would be awesome. I think getting started is hard for folks, right? And everybody's circumstances are going to be slightly different. I wouldn't expect counties' documents to look exactly the same, but sometimes I think just having something, because you're right, it does feel a bit like we're starting from scratch here.
And Jasper County has theirs on their public health website.
Okay.
And it's pretty basic. And I would say I estimated with ours, we're giving out $200,000 grants, and I estimated it would take people 6 to 7 hours to fill out our application, which I would say is probably the most that you would want. You don't want to put too many barriers on it, but we also wanted to make sure we were doing our due diligence. And that estimate was for someone who's never applied for a grant or really wanted to do a very good job.
I'll pull up Jasper counties too. And when we send out the email after this, I'll put that link on there too, just so you can see maybe a couple of variety examples.
I have a form as well for Lynn County.
Sonia, if you'd be willing to send that my way, I'd be happy to share it with people.
Yep, I will do that.
Thank you. The other question I had come in ahead of time is sort of along these lines too. So those questions were sort of focused on making awards. But I had one county ask just about the process to get a committee set up to start thinking about how to use the funds. And I know several counties have done that at this point. So anybody's willing to share just kind of how, again, I know it varies from county to county. We've talked about it some, but if anybody would be willing to share just kind of who's on their committee and how they came up with appointing people to that committee, I think that would be helpful.
The committee we have, one, our county supervisors came to our prevention coalition and asked us to help in Van Buren County with the funds. So I drew a committee together of our hospital staff, our EMTs, our police department, our health department, and our schools. And we're a very rural county, so those were our key players for our community that we drew together. And that's how we're working. And we've also now included our pharmacy, our local pharmacy in that as well. Did I say law enforcement? Because we included law enforcement too. But we're also utilizing our funds for promoting our drop box in our community with a billboard, stickers for the pharmacy. We're working with our pharmacy to provide locking pill bottles to customers that get a controlled substance prescription, and then they're putting stickers on their bags, and then we're going to try to help them get a drop box at the pharmacy as well. So those are the things we're using our funds for so far.
And I can just add quickly, our public health administrator, Lindley Sharp, coordinated most of this. I'm just sitting in today. But to add to what Chris said, we had focus groups as well. And we are continuing to do a SWOT analysis. And the only other one I'm thinking that she didn't mention was we do have a church representative, because they do have a recovery group at one of our churches. And if I think of more, I'll add it.
Can I ask if you set term limits for these committee members?
We did not. We just tried to include our key stakeholders and agencies that are working on opioid prevention in our county. And that was our goal.
We did not either. We're happy to have anybody sit at the table.
Any other questions about committees or examples that folks want to share?
Oh, I should also mention, our county attorney is very involved as well. So we have focus groups that meet, and the three of us, Lindley, myself, and the county attorney, are the facilitator of the individual groups, law enforcement, judicial system, community, schools, faith-based.
Gabby, I'm also working with a group in Lee County right now, and they just did not focus groups, but they did interviews and a survey with people with lived experience. They partnered with their parent partners and jail diversion to do that, as well as our substance use treatment.
Thank you.
I had a couple other questions coming about uses. Oh, go ahead, Krista.
I was just gonna jump in. We haven't started meeting as a committee yet, but
Some of the key players are very similar to what people have already stated about law enforcement. We have a drug task force here. So one of their members, Area Substance Abuse Council, ASAC. We have one MAT provider. So they're part of our committee as well. And then our harm reduction group. So those are some of the people, and then very similar to what other people said. And then I'm currently working with the Opioid Response Network with their free resources to kind of build a strategic plan that'll help guide the committee and what we want to do for the county with our funds. So that's kind of what we're doing in Dubuque right now.
I had a couple more questions coming about uses. One specific, asking about drug court. I believe we talked about that last time. And any of these uses come with the caveat of talk to your county attorney, make sure they feel comfortable with it fitting into one of the uses under the MOU for the settlement dollars. But I think there was a section of the MOU that seemed like it applied to drug courts. I don't know if anybody else has additional thoughts on drug courts, but I think that's what was discussed last time. And then I had a more general question just about sharing what others have used the funds for to try to come up with some ideas. So if anybody wants to jump in and share some of that now. The other question kind of along with that I would pose to the group, are you interested in me requesting all the county reports from the AG's office so that we can do something with those and get those posted so that people can see them? And I don't know, I haven't actually seen any of those reports to know. Everybody's sort of just getting started, so I'm not sure there's a lot of data in those reports for us just yet. It may be more beneficial next year for us to pull those and try to, put them together in some way that you can kind of see what counties are doing.
Christy, I was also wondering about the state. We don't want to duplicate. So what is the state doing that we shouldn't be doing?
Yeah, we don't know. I'm not sure they know. So there is a bill, gosh, and I haven't talked to Jamie and Lucas about it super recently, so I don't know quite where it's at or what's happening. A lot's happening right now with session. I think they're moving towards the end. So whether or not the bill will pass this session or not, I don't know. But there was a bill about it, basically creating a administrative type committee. So 50% of the funds went directly to the state. And so the bill only covers that 50% that's going to the state. It does not impact the dollars that are going directly to the county. I want to say that very clearly so people don't get worried. This is about the 50% that went directly to the state, not the 50% that went directly to the counties. But if we're talking about the part that went to the state, there's a bill pending that would basically create some type of administrative committee to oversee and make recommendations on how those dollars are spent through guidance from HHS. We don't know really any more about it. There are a couple little things in that bill that we're working on. They were going to have counties do an additional report to the state, to which we said we're already doing that. You just need to talk to the AG's office. But other than that, it doesn't directly impact counties. But Jan, you make a good point. As the state's dollars move forward, not only do we not want to repeat efforts, but there may be opportunities. I'm assuming they're going to do some sort of grant type application. There may be opportunities for counties seeking additional funds to apply for some of those state dollars as well. But I don't have a lot of great information on that at this point. It's moving slowly.
I was actually just looking at the bill before this meeting that passed the House. So what most likely is going to pass is that 75% will go to Health and Human Services of the state allocation, 25% will go to the AG's office. And then a council of people will field grant applications from folks across the state, mainly focusing on prevention and treatment. And distribute and then send their approved applications to the legislature to do final disbursement of the funds. So yeah, take that as you will. I'm concerned that there's nothing about people with lived experience in the bill. That's not a requirement that someone with lived experience be on the council. You know, obviously only focusing all the state's money on prevention and treatment. There's nothing about recovery and harm reduction, could also be problematic. So if you have feelings about that bill, now's the time to reach out to your representatives and senators is more important because it already passed the House.
Yeah, definitely, Gabby. I mean, it's either probably going to happen in the next couple of days or it may not happen this session from the sounds of things. So definitely take a look at it. I will find the bill number too in case folks haven't seen it and send it out with kind of the follow-up from this. Oh, Gabby already put the link. Thank you, Gabby. The link is in the chat. I will also send it out in the follow-up email. If you want to take a look at that and follow along. So I think that's all the questions I sort of had to cover today, but I would open it up to the group for a little bit if there's anything else that you would like to talk about, including, we don't have our next meeting scheduled, but I will probably try to do it, you know, in the next month or so. Try to keep these monthly unless somebody tells me that's too much or not enough. But you know, if you have anything particular you want to hear about next time, if there's any sort of speaker or somebody that I can bring in to share some information, let me know. And like I said, if there's anything else you'd like to talk about today, now is your opportunity. Okay, since I'm not hearing a ton, wait, Jan, your camera came back on. Do you have something else?
Just one question, and maybe I've
Sure.
missed it. Are we having another in-person like we did last year?
Last May. So we don't have anything scheduled like that. That being said, if there's something that folks really want to hear about and it would be better in an in-person setting, we're not opposed to that. We don't have anything lined up, but I'm open to ideas if there's something that would be helpful.
And maybe it's too soon. Maybe next year would be great. Then we'll have lots of data.
Yeah, you know, I keep kind of waiting for when we kind of get over that hump of getting things started, because I think you're right. I think once people get into it, there might be a lot of different types of questions. Okay, well, not hearing anything else, I will give you guys back some more of your hour here, but watch for, like I said, we'll send out a follow-up email with the recording, with the chat links, and then I've got a list of several other things that I will get sent out as a part of that as well. And then just watch for, we will get next month scheduled. And in the meantime, think of questions or things you might want to share. And if you have any other ideas or any other ways that we can support your work in this, just let us know. All right. Thanks everybody for your time today. Have a great rest of your afternoon.